Okay, okay, guys, we're on to our next topic, which is pharmacodynamics. This is a super important topic. Sometimes I teach this right at the beginning of the class because I think it helps put into context all the pharmacokinetics we're learning. But I don't know. It's a chicken and egg situation. But anyway, as you know, this class is called Introduction to Pharmacokinetics and Pharmacodynamics, and this is the first time we've really talked about pharmacodynamics. So this is, like I said, an important topic. We're going to talk about kind of the definitions first, and then move on to all the ins and outs of it here. So I'm not going to read all these to you, but you now have the objectives. And now we'll move on to the definition. So, pharmacokinetics versus pharmacodynamics. So, pharmacokinetics has always been about the relationship between the amount of drug that we're giving, or our dosing regimen, and the resulting concentrations around in the body, right, that we achieve. So kinetics has always been about this relationship between the amount of drug we're giving and the concentration we achieve around the body, right? Whereas pharmacodynamics kind of closes the loop. So what we really want to know is what's the relationship between the amount of drug we give and the effect that we get, right? So what we really want to know is if we give a certain amount of drug or we give a certain dosing regimen, what's going to be the effect? That's what we really want to know, right? We want to be able to know if we give a certain dosing regimen that will get a certain effect. Well, kinetics only takes us part of that way. Kinetics only takes us from the dose rate. This is so slow. From the dose rate to the concentrations we achieve, right? So that's kinetics. So how do we get from the concentrations we achieve to our desired effect? Well, the relationship between the concentrations we achieve and the effect that we get, so concentration to effect, is the pharmacodynamics. So this is dynamics, and this is kinetics. So what we've been studying so far is when we give certain dosing regimens, what happens to the concentration, right? That's what we've been studying thus far. And what we're going to study now is the dynamics, the relationship between the concentrations that we get and the effect that we get. If we marry these two together, then we can go from a certain dosing regimen to get a certain effect, which is what our main objective is, right? So this is another way of depicting this. What we've been studying so far is when we give a certain dosing regimen, what concentrations do we get? Our bioavailability, distribution, and clearance results in certain concentrations. So we've been looking at this concentration time issue here, right? Then we can take the information of those concentrations now, and so the concentrations we get, and relate those to an effect here. That's what we're going to be talking about today. So this here, we can have our concentration on our x-axis, and what effect will we get as we change our concentration, as we increase our concentration, what's going to happen to our effect. So this is pharmacodynamics, the topic of the day. Okay, now we know that there is, looking at this, trying to figure out what pharmacodynamics is, we know that we can't just give, we can't just have not every plasma concentration equals a certain effect in every situation. There's considerable inter and intra within people and intra within the same person variability in the relationship between response and plasma concentrations. Maybe you thought that was fixed, but it is not always. A lot of times it is, but not always. Okay, and just as a little, this is for lay people, not for pharmacists, but if you're talking to your parents about this, pharmacokinetics, as we've said, studies the effect that the body has on the drug. I mean, most people understand that when we give a drug, we're going to get an effect on the body. It's the whole reason that we are giving the drug. But what we don't consider is that as soon as that drug is introduced to the body has an effect on the drug, doesn't it? It will basically, your body's trying to get rid of the drug as soon as it's introduced, right? So it's going to be changed by bioavailability, which we know is determined by Fa, Fg, and Fh. It's going to be moved around in the body depending upon the volume distribution, which is really about binding, right? And it's going to be eliminated, which clearance is a little more complex. It depends on if it's renal or hepatic, right? If it's renal, we're asking, is it primarily secreted or reabsorbed? And for hepatic clearance, is it low E or high E, right? And then we can go into what determines all of that. But that's our kinetics piece, yes? Oopsie, sorry. I'm trying to get rid of stuff and I'm just causing problems. Pharmacodynamics, on the other hand, studies the effect of drug on the body. So, that's the layman's terms, but okay. So let's get into that. One of the things is that we have trouble is we tend to over-rely on pharmacokinetics. So when we monitor a patient and we see that maybe the concentration that we're monitoring is too high, we may freak out and decrease the dose rate without thinking it through and saying, are we actually monitoring for therapeutic and toxic effects or endpoints? So let's say high concentrations lead to increased heart rate, for example. Are we monitoring that? We should be, right? Because the pharmacokinetic, the concentrations is just one piece of information, and it needs to be among many pieces of information. So we should always be monitoring for therapeutic and toxic side effects and endpoints. Because therapeutic ranges are guides only. They're only population averages of ranges. So your patient could have a higher therapeutic range or a lower therapeutic range than the population average. And measuring drug concentration is only a tool and one data point. Should never be relied upon as the only data point. So you need to know both the kinetics and the dynamics of the drug. So what should we be monitoring for every drug to look for toxicity or lack of efficacy? I can tell you when I used to teach students in the hospital, One of the things I asked for every drug a patient that was on that they were following, for every drug you need to know what to monitor for both efficacy. So is it an antibiotic? Do you need to look at white count, temperature, cultures, other issues to look to see if the infection is getting better or getting worse? And you also need to look for toxicity. So is it toxic to the kidneys? Is it toxic to the blood cells? So what do you need to monitor for? I made sure every student could list that for every drug that they were on. So that's something you might start working on. For every new drug you learn, what are you going to monitor for efficacy and what are you going to monitor for toxicity? This is important. You may also look at concentrations as one of these things, but it should only be one of your data points. All right, so I think we're done with this introduction to pharmacodynamics, but we're going to talk about receptor theory, dose-response relationships, potencies, therapeutic index, and drug interactions from the standpoint of pharmacodynamics. All right, see you in the next one.